I am humbled to receive the Bernard Macik Distinguished Physician Leadership Award, but I don't see this as an individual honor. Rather, it reflects the dedicated work of all those around me. Thank you to the imaging technologists, nurses, and department managers who work so hard to do what is best for our patients. We are all part of a team, and I could not do my job without you. As a radiologist, I may not be the physician you see at Morton Plant Mease, but I am there, working in the background every day to help you. Although I mostly sit in front of a computer, I remind myself that every exam represents a patient who needs help. I am responsible for assuring the highest quality of your imaging examinations, making sure that we have the best chance to diagnose your illness. I also take great interest in and enjoy leadership on the Mease Medical Executive Committee. The decisions we make influence how the medical staff works and how we coordinate our efforts with the hospital staff and administration. Our goal is the same as Baycare's mission, to provide high-quality, compassionate care. We've had some tough decisions to make, and sometimes the answer is not obvious. But I always go back to my guiding principle when offering my opinion: what is right for our patients? I would like to tell you a brief story. A year or so ago, I was working at Mease Countryside Hospital when a patient came into the emergency department on a Friday. He was in his 50s and quite healthy until he suddenly experienced symptoms of a stroke. And this was a big one. He was what we call locked in. That meant he couldn't move any of his body except his eyes and couldn't speak. This is a devastating diagnosis. For the rest of his life, he would only be able to communicate by moving his eyes. As you may imagine, the stroke team went into action fast. Within a few minutes, the patient was in radiology getting a CT scan, with a special additional scan called perfusion imaging. A regular CT looks mainly at brain tissue, but this one also looked at the blood vessels and blood flow in the brain. The scan showed that a clot had lodged in a large artery in his brain, but even though he was having a stroke, the affected part of his brain had not died yet. I called the results to the stroke team and I went back to reading other exams. I couldn't get this man and his condition out of my mind, so after a few minutes, I walked over to the interventional radiology suite, where the patient had been sent in an attempt to treat the clot. The clock was ticking. Too much longer and the brain tissue would have died. When I walked in, I was stunned to see a 1-inch clot in a jar on the table in the treatment room. My partner had pulled it out from the artery deep in the brain by going through the groin with a catheter and other tools. The patient walked out of the hospital normal and with no permanent deficit on Monday, 3 days after he came in. Why did I tell you this story? Because none of this would be possible without you, our benefactors and donors. You give your time, your money, and your energy to help make Morton Plant Mease better. You know, as I do, that our healthcare system is part of the fabric of our community. It is where you go when you get sick, and it is where I go when my family needs care. The stroke patient survived because your philanthropy enables us to acquire better equipment, like the CT scanner that allowed us to do the perfusion study and determine that the patient's brain could be saved. Without you, my partner might not have had all the tools at his disposal to remove the clot. Finally, I thank my wonderful wife Polly for her support, guidance, and love. By example, you have taught me to stand by my principles, always do what is right, and how to lead by example, to get in there and do the dirty work. I am forever grateful to you. So thank you for this award, but I know that it represents the efforts of everyone here tonight. Thank you all for sharing this evening with me.